So if you're watching this video, then odds are that you also suffer from thyroid issues, most likely hypothyroidism or something related with Hashimoto's. So I have been dealing with this disease for the last few years now. I have what is known as underactive thyroid or hypothyroidism, and the root cause of my underactive thyroid is an autoimmune condition called Hashimoto's. Now the doctors here in US, at least the experience that I have had, they're not very helpful. So in my case, they have been prescribing me medication to keep my thyroid hormones in check, so Synthroid and Cytomol. But the root cause of my problem, the doctors seem to be not interested in fixing that issue. So what I will do in today's video is that I will react to a very informative video that I stumbled across on YouTube. And so these are two doctors, they are qualified and they actually know what they're talking about. And unlike my doctor, seems like these two guys are more helpful.
Oh, Mark, thanks for having me. It's always a pleasure.
Okay, so let's get into it. We're going to talk today about a very specific kind of thyroid dysfunction, which is probably the most common type of thyroid dysfunction, called Hashimoto's thyroiditis. Now, that is an autoimmune disease that gets treated in a way that really isn't that great for most of the people because
Absolutely right. So I have known that I have this Hashimoto syndrome for a while now, but I have not really been getting good, medical advice or a good treatment from my doctors. They are just happy prescribing me, Synthroid and Cytomol.
they don't feel that great, even if they're treated by the traditional endocrinologist. So
Absolutely true. Absolutely true. So my TSH, my T3 and T4, those typical hormones that the doctors measure, those are now normal. They are within the normal range. In fact, I will show you my medical chart. Yeah, so let's take a look at my T3. This is the T3 free, and it is under the, for a while it did go up here. This is 4.3, but 2022 and my last check which I had in July of 2023, it seems to be normal, and this is with my medication obviously. So my T3 looks normal. My T4 is also fine. With my medication I seem to have it under control, and this is my TSH. So if this is high, like in my case, it was 5.18 in 2019, and that's when I was diagnosed with hypothyroidism. So if this number is high, actually this was like 7 or something for me. 6 months before also I had got another test. So after that I started taking medication. As you can see, it's actually normal. So my numbers look good, but my problem is I don't feel good. Even though my TSH, T4, T3, they all look normal, but I feel like crap. I get up in the morning, I feel tired, I feel exhausted, I also feel mental fogginess. So something is definitely not right with me. I think my doctor is not really doing a proper diagnosis. So let's get back to the video.
first, what is Hashimoto's? Sounds like some kind of Japanese dish. And what is the consequences of that for people who have it?
So Hashimoto's, when my doctor first told me that I had Hashimoto's, I actually got scared because it sounded like some kind of a terminal disease, like, cancer or something. So at least it's not that bad.
As you said, it affects a vast number of people in our country. 27 million Americans have thyroid dysfunction, and 12% more are likely to get it every year. Hashimoto's is the most common cause of that dysfunction, particularly hypothyroidism. And Hashimoto's is an autoimmune process. What is autoimmunity? It's when your body's immune system starts making antibodies against your own tissue. And in this particular case, it's the thyroid.
And this is the most common autoimmune disease in America, right?
It is. It is.
And we don't really treat it as an autoimmune disease.
No, we treat it as hypothyroidism.
This is exactly what my doctor is doing. My doctor is treating my thyroid issue as just hypothyroidism. So she's just happy prescribing me medicine, and she doesn't really care much beyond that. I'm actually glad that I was able to find out that I have Hashimoto's. And by the way you find that out is there is this test. This is a thyroid peroxidase test. What you are seeing here are the antibodies, and they should be below 9 IU per ml, and I had 87. So these elevated presence of these antibodies, they basically mean that my immune system is attacking my thyroid gland. It thinks that it is some kind of a bad thing. So basically it's misfiring, right? It's basically attacking my own tissue. Now I have been able to bring it down to 33. It's still high. It should be less than 9. My last test it was 33, and I will talk about how I have been able to bring it down as we watch the video. But this is how you find out if you have Hashimoto's. And so if your doctor is not giving you a test, you can ask your doctor to give you a thyroid peroxidase test.
And there are probably many women, and we speak mostly about women because they make up a large number of the patients we see with Hashimoto's. And a large number of these women do not feel better when they're treated. And they get diagnosed with hypothyroidism without ever being tested for Hashimoto's. And the reason being is, I think, the big disconnect in conventional medicine. And that is that it's seen as a thyroid condition.
Yeah.
And it's really an autoimmune condition that affects the thyroid.
Yeah.
And in that setting, with that mindset and that paradigm, the thought is, well, it doesn't really matter where the hypothyroidism comes from, because the belief is that there's nothing to impact that immune response against the thyroid. We just, in conventional medicine, you just sort of let that immune response continue flaming until the thyroid is burnt out.
This is exactly what my doctor told me. My doctor said that, yeah, you have this autoimmune condition, but there is nothing we can do about it because we don't have a treatment for Hashimoto's. So just take your Synthroid and take your Cytomol, and that's all I can do. So he's absolutely right. This is exactly how my doctor has been treating my Hashimoto's. Argument is that, like, why bother with Hashimoto's? There is no cure for Hashimoto's. So just take your medicine, and as long as your TSH, T3 and T4 are within the normal range, you should feel good. But unfortunately, I don't feel good. So that's my problem. Now, what I find interesting here is he's saying that women are mostly affected by this. I guess I am one of those unfortunate men who are, affected by Hashimoto. It really sucks.
Yeah.
And then the person is on whatever dose of thyroid medication will get their thyroid number, their TSH, into the normal range.
Yeah.
And then that's considered good medicine.
Yeah.
One problem.
What
There's a
is
lot
that?
of women running around with a normal TSH that still feel like crap.
That's it. That's how I feel. My numbers are fine, but I feel like crap. So it's not just women. I guess men are also affected by this. But women are affected in a more higher percentage.
That's right. So a lot of people
So there's
who
something going on.
are diagnosed, by the way, half of people with low thyroid are not diagnosed.
Oh, wow.
Oh, yeah.
Okay. So that's a problem in and of
Yeah.
itself. And if you're talking about 20% of women, it's a lot of people. And 10% of men, it's a lot of people.
Okay, so that's interesting. 20% of women have thyroid issues, so 1 in 5, and 10% men, so 1 in 10. That's a big number.
That's one problem. The second problem is, like you said, we treat it by just giving people thyroid replacement without actually dealing with the root cause of why their thyroid isn't working in the first place. It's like the same way we treat all other autoimmune disease, which is we say, oh, there's inflammation. Let's give you an anti-inflammatory drug, right? Whether it's Advil or steroids or chemotherapy drugs or immune suppressants that are super powerful and cause cancer and overwhelming infection and death in many people. Like, we don't go, what's the cause of the inflammation? So, George, with Hashimoto's, which is, again, so common, what causes the autoimmune disease in hypothyroidism, in this particular kind of autoimmune disease?
There are thoughts, there's no clear understanding of the exact mechanisms that cause the immune system to go awry. Autoimmune diseases tend to cluster. If you have one, you're much more likely to have another. The reason why Hashi's is most prevalent is that there's a strong connection between Hashimoto's and gluten. That a large number of patients that have Hashi's also have genes that make them more predisposed to gluten sensitivity and celiac disease.
So this is something which I found out a few years back, what he's talking about, that gluten can trigger, this autoimmune condition. So I showed you my results here, right? So this is my thyroid peroxidase results. and as you can see it was 80. So the reason I was able to bring this down was because I started cutting down gluten. I was not able to fully cut it down because predominantly I eat a lot of gluten, because North Indian diet, it's mostly naan and chapatis and all those things. So there's a lot of wheat in a typical diet that I consume. So I was eating a lot of gluten, and so I started cutting it down and I saw a positive correlation. And then here I think I lapsed and I started taking some gluten. I remember going to a cheesecake factory and I ate a whole bunch of bread. So I think after that this shot up, and then since then I have become very particular, and now I have completely cut off gluten from my diet. Completely cut it off. So I'm gluten free now and my numbers are dropping. So it's 33. So gluten definitely has a high correlation with Hashimoto. He's 100% right. So this is something that my doctor never told me, but I found it out and I tested it myself by reducing gluten in my diet, and it has made a positive impact.
Gluten, therefore, is seen as a pretty strong trigger to Hashimoto's.
Yeah.
Now, I would say if you're thinking about what's the one thing that you can do if you think you have Hashis, go gluten free.
Or check your antibodies.
Right, or check your antibodies.
I've checked antibodies for years on these patients because I think this is a pretty well established phenomenon in the literature. This is not like you can go on PubMed, which is the National Library of Medicine, look it up, Hashimoto's, gluten, you'll come up with plenty of articles. And yet your traditional endocrinologists don't even look at it. And I checked antibodies on every patient with hypothyroidism, with Hashimoto's, and about 30% of the people have some level of antibodies. They might not have celiac, but they have some level. And so tell us, why is gluten so connected to autoimmune disease?
So before he says that, I just want to make sure that you understand what antibody he's talking about. So this is thyroid peroxidase, and this is the one, thyroid peroxidase AB. This is the one that you want tested. So if your doctor has not asked for this test, then you should insist that your doctor write this particular test for you. So I got my blood work done from Quest Diagnostic, and they do offer this test.
Gluten is very similar so what gluten can do is it can trigger something called leaky gut. Gluten, which is very prevalent in our processed foods, does one more thing. It triggers something called zonulin, which is the gatekeeper. Zonulin is the compound that's responsible for opening and closing the gates that allow good nutrients and compounds to enter in, and then closes to make sure we keep out bacteria, viruses, and toxins. Because when gluten enters in, there's the leaky gut. Now the immune system sees it as a foreigner, and it begins making antibodies against it. Unfortunately, those antibodies are also made against the thyroid because the gluten structure is very similar to the thyroid. So you get this sort of molecular mimicry that causes the immune system to become confused, and now it's making antibodies against your thyroid.
Wow, so that is amazing. So I have completely cut out gluten from my diet, and if you have Hashimoto's, I would strongly recommend that you get that antibody test done, this one, thyroid peroxidase. And if you are looking like mine, if your numbers look like mine, anything above 9, so basically in double digits, if your numbers are in double digits, then you have, you should cut down gluten. I am at 33. My goal is by next year, I want this to be below 10 and I want to feel good. So that's what I'm trying to do. And that's why I'm making these videos, because I want to share my progress with you guys.
And studies have shown that people with Hashimoto's, when they cut out gluten, their thyroid antibodies come down. Their autoimmunity gets less.
Absolutely. And I would also, in regards to the testing and looking particularly at something called thyroid peroxidase antibody, because that's the antibody that's made. It's made against this enzyme that the thyroid makes that's responsible for making thyroid hormone. It can also make an antibody against thyroglobulin, which is another compound that the thyroid makes that is also responsible for making thyroid hormone.
So this is a really informative video. I will link the full video in the video description below. You guys can watch it. But for today, I guess the gist of today's video is, if you have Hashimoto's, if you have underactive thyroid, stop consuming gluten. Gluten is what is screwing you. Gluten is what is causing all your problems. So cut down your gluten and hopefully you will feel better. So that's it for today, guys. Hopefully you found this video useful. And if you have any questions or comment, leave them in the comment section below. And I will see you guys in my next video. Bye.